Welcome to Breakfast with Spaniels with Dr. Judy Morgan. Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Good morning. All right. What day of the week is it? It's Wednesday. I said I would talk about hemangiosarcoma because someone emailed me and asked me if I would talk about it because she lost her dog to it. I've done many videos on it. I think I even have a couple of blogs, but we'll talk about it again. Today, I believe, is the beginning of the AFCO meeting, and I apologize because I've been remiss in posting where to go to listen to the meetings and the schedule of the meetings. So I'll make myself a note to do that. So I don't forget. So if anybody wants to tune in, you can listen. You'd be in listen only mode. The whole meeting is virtual this time. Not headed south yet. No. No messages from Gwen today. So little Sarah's just sitting tight. When she went to the doctor's Tuesday, they said she's progressing, and they said, well, could be any time now, could be tonight, could be next week. She has an appointment to be induced next week if she doesn't have a baby by then. Her dad is on standby to hit the road. We're on standby to get news. So that's where we are. Oh, you're welcome, Avis. How is Caden today? I hope she's doing okay. She was a real trooper yesterday. Yeah, interesting. Somebody says they're in Cape May and they never lost power. The storm was pretty ferocious. Delaware got hit really hard near where Hugh's daughter lives, his younger daughter, and the Jersey Shore got hit really hard with a tornado down there as well, and a couple in North Carolina. I mean, it was interesting. And Bonnie Hirschman, I think she's on. She lost power. She lives in Clayton, a couple blocks from our office. Our office didn't lose power, thank goodness. We had flickering lights a couple of times, but it's a beautiful day in the neighborhood today. So, Avis, you've been without power for 24 hours. Lovely. And she's down near the shore. So, all right. So let's talk hemangiosarcoma. Hemangiosarcoma is a blood vessel tumor that we see very commonly in the spleen. Sometimes it starts in the liver. Sometimes it starts in the kidney or the space surrounding the kidneys. And another very common place is heart base. Extremely common in golden retrievers, but really we have seen it in just about every breed. Pretty rare in kitty cats. And unfortunately, there are no blood markers for hemangiosarcoma. So you can have a blood test today that's perfectly normal and your dog can die from a ruptured hemangio tomorrow. Frankly, most of them are diagnosed when the dog collapses on a walk because the tumor ruptures and they start to bleed into their abdomen or into their chest. We had a case Monday where a client brought a dog in for a dry cough. And the client was pretty astute. And he said, I think something else is going on. I don't think this is just a cough. It had been diagnosed elsewhere as laryngeal paralysis. And he said, I don't think that's what it is. And so we took x-rays, and no, that wasn't what it was. It's got a tumor, a basketball in the abdomen. So he immediately left our office and headed over to the specialty center to have surgery Monday night. And I don't know the outcome. So watching the Today Show and they're showing the damage, yeah, there was quite a bit. First golden diet of hemangio. Yeah, it's really common. And so this person who emailed me said, I thought I was doing everything right. My dog was raw fed. Very minimal vaccines, don't use chemicals, and the dog still got hemangio. Yeah. I mean, that's unfortunately where we are with cancer. Over 3/4 of dogs that live to age 10 will have a cancer diagnosis. And there's a good percentage of them that will die from that cancer diagnosis. And I mean, I've had other clients who are extremely holistic, no vaccines, no chemicals, raw fed, and their dogs at middle age get just horrendous cancers. We don't know the cause of all cancers. I do know that we live in a toxic world, toxic environment. Our food chain is incredibly contaminated with things like glyphosate, which is Roundup. We have all these genetically modified foods in our food chain now. We are destroying insect populations that we need. We're destroying the food chain from the bottom up. I think there's genetics involved with it as well. Why are golden retrievers and Rottweilers so prone to this disease? There was the spay-neuter study done on Goldens and another one done on Rottweilers that showed that early spay-neuter or spay and neuter in general contributes to more cancer, or at least they had more cancer diagnoses in dogs that were spayed and neutered. I think we need, got hair in my eye. I think we need a lot more information. They looked at that study and they were looking at arthritis diagnoses, hip dysplasia diagnoses, cancer diagnoses, and spayed and neutered versus unspayed and neutered, and basically just looking at the proportion of diseases, a whole list of diseases. But it's not, and they were only looking at spay and neuter, but it's not a great a great study in that there's so many other variables that go into that. We would have to look at the diet that all those dogs were fed. Are people that keep their dogs intact more likely to be feeding a raw diet, because that tends to be the people who are more natural or they're show dogs? Are they using less chemicals versus the dogs that might be a household pet that got spayed or neutered early and then is fed only a processed kibble, might be using more flea and tick chemicals, either topically or orally? There's so many, it's very hard to do large scale studies with big groups of dogs and narrow it down to one variable. So while I do agree that leaving our dogs intact longer is better from a lot of standpoints. I mean, let's face it, we don't spay and neuter people at a young age, just willy-nilly. There's a reason there's hormones there. There's a reason we have those organs, and they do a lot more than just support reproduction. Those hormones are important for a lot of things. So if your dog or your cat gets cancer and you think you've done everything right as far as feeding a high quality human grade diet, minimizing or not doing any vaccines, not using any flea, tick, heartworm, whatever chemicals, not using antibiotics, you can put your pet in a bubble and still have them develop cancer and die from cancer. And the same, I mean, why do small children get cancer? I don't know. I have a veterinary friend, her son in 8th grade had a brain tumor. Why? Nobody else in the family had that problem. So we just don't know. We really, really don't know. So, and I think many of you who watch and listen, part of the reason you watch and listen is because you've lost a pet to cancer, kidney failure, autoimmune disease, something where you feel like traditional medicine failed you. And that's kind of how a lot of people end up finding us more holistic veterinarians, because you feel like you were let down by the traditional system. And I think in a lot of ways, the traditional system does let down a lot of owners. Somebody Facebook messaged me yesterday or the day before and said, I feel so bad. I got NexGard for, the puppy pack, got the NexGard and the Heart Guard. They're freebies in the puppy pack, and gave it to the dog. And dog's been itching like crazy uncontrollably, which is one of the side effects of NexGard. And she said, I just want to kick myself for not doing the research. I blindly gave it to the dog. And she said, but now, when I started doing the research, I found you, and I want to do things more holistically, and I just want to kick myself. And I said, well, you don't know what you don't know. And now you do know. So now you get to do it differently. And you don't know what you don't know. So we have to be nice to people who don't know, and educate them nicely and help them, so now this poor woman, she's like, oh, how do I get this out of my dog? Well, you can't. How do I detox the dog? So I gave her some ideas for that. That's the best you can do. Once you know better, then you can do better. And it's up to us who have more education and are more aware of the side effects and the problems, in the pet food industry, in the veterinary industry, and whatever, so that we can help people do better. But if you lose a pet to cancer, do not kick yourself, because we lose people to cancer every day, a lot. So, okay. Your vet prefers chaga mushrooms to turkey tail for cancer support. You know what? All the mushrooms all the medicinal mushrooms are good. So just pick one. Doesn't really matter. Mushrooms are just good stuff. How am I feeling from my spill? I'm a little stiff and sore. I feel a little bit beat up, but I'm okay. Yeah, milk thistle is a good way to detox. Really good human grade ingredient foods, organic if you can afford it. We can't even afford all organic for ourselves. Yeah. So Belinda says her dog was diagnosed with hemangiosarcoma at 13 and a half, no surgery, changed her diet, lifestyle changes, and she lived an extra year and a half. And we see that. We've had them live 2 to 3 years. But it's a gamble. You can't pick and choose which ones are going to hang in there and which ones are going to go next week. Carolyn, with the itching from the flea and tick meds, it depends which one he was given, but if it was April and if he was given Bravecto, that's a 3-month medication, but the side effects from these things can last 12 months or a lifetime. Some of the neurologic side effects last a lifetime. It's very sad. Okay, everybody have a wonderful day.